Ms. Ali. And it's an absolute pleasure to speak in this debate. And I, too, want to give my congratulations to the Honourable Member for Bradfield South, as well as for my honourable friend, the Member for Waveney. One of the great advantages of speaking quite late on in a debate such as this is you can jettison all the interesting facts and figures that you've carefully researched in preparation for a speech like this, because they've all been mentioned several times already. So I want to focus instead, Ms. Ali, on providing the Minister some local feedback from my constituency of Broadland, so that she, in her deliberations on how best to improve the dental contract and provision for all of our constituents, she can hear from the horse's mouth just some of the nuances which are experienced in Broadland and in Norfolk and Waveney more widely. It's the most significant input on my inbox for healthcare. So beyond any other healthcare issue, it's dentistry. Comes in week after week after week. And it's not just about ability to register to get initial access, but it's actually about getting dental work completed. And I've got a huge list of constituents' casework, which I'm not going to bring to your attention, save for one, which just gives a flavour of some of the seriousness of the missing treatment currently, which is a constituent of mine who had 2 fillings fall out, which is a fairly common experience, and she was unable to get any dental treatment to deal with that. So she ended up having to ring 111, where she was told that because of the lack of dental provision in the county of Norfolk, she was encouraged to do a DIY filling. That was by 111. And every day is a school day in this job. But I now understand that if you use the wax from Baby Bell cheeses, that is how you perform a DIY filling recovery. Now, should we be in that sort of position? I, for one, think that we should not. I just use one. There are all sorts of different other examples that I could have done, that I could have raised with you. But I just want to drive home the real impact that, for whatever reason, we're in the position that we are now, and some of it's COVID, but a lot of it isn't. We must, as a government, address it in the support of all of our constituents, however they voted. So that's from the constituents, but I've also got feedback from my dentists, because I have the honour to represent a really fantastic town called Fakenham. We've referred to it a couple of times already in the speech. And one of the 2 NHS dentists announced a few months ago that they were no longer accepting NHS patients and they were going private. So I rang her up to find out what was the reason behind that. And she's a very decent woman who's worked tirelessly for the community of Fakenham for many years. And what she said to me wasn't primarily about money. It was actually about the way that she was treated by her NHS managers that caused her frustration to reach such a pitch that she thought, stuff it, I'm not putting up with this any longer. And one of the aspects that she referred to that particularly stuck in my mind was that even a year ago, she had a direct person that she could talk to as part of her management team. And so when there was a problem, she could ring up, she could actually talk to someone. That was replaced by an email. And she said that she has emailed every week for the previous 12 weeks about a really serious issue. She hadn't even had a reply. So if you treat professional providers in that offhand way, can we be surprised that they decide to move to private provision? Because that is an option that every single NHS dentist has, and they have been voting with their feet. So I've already mentioned that it's not primarily about money, at least in that instance. But I do welcome the £50 million additional spending that the department has announced, the 350,000 further treatments that that apparently is going to provide. And I very much welcome the decision by the Department of Health to award a new contract for dentistry for Fakenham, because we were down to a single NHS provider. And this is the largest town in my constituency. But as has already been mentioned, I think it was by the Honourable Member for West Norfolk, North West Norfolk, so I'm so sorry, my neighbour, that we haven't been able to provide it. We haven't been able to entice any dentist to take up that contract, even though the money is available. So why is that? Why is it that a fantastic town like Fakenham, which is a brilliant place to live, 5 miles from the gorgeous North Norfolk coast, really lovely quality of life, relatively speaking, low housing costs. It's a great place. It's got its own racecourse. Thank you very much. It's also got a good golf course. It's genuinely a really gorgeous town. Cannot attract anyone to take on the NHS dentistry contract that is available. And as my honourable friend and neighbour, the member for North Norfolk, has pointed out, one of the reasons is that we have no training facility, not just in Norfolk or Suffolk or even Cambridgeshire or even Bedfordshire. The nearest place is London. You have to go up to Birmingham or London. And so when you're trying to persuade particularly young dentists where they're going to set out their professional career, their professional lives, it's not automatically attractive to move to a rural or small town. You have to encourage people via training. And we know from our experience with the medical provision at the UEA and the Norfolk Medical training in Norwich, that very often where you train, you're much more likely to stick around afterwards because you've established relationships, you've got contacts with the community, and frankly, you know what a great place Fakenham is, and other parts of Broadland. So
I'm going to go on holiday now.
it's really important. One of the primary reasons why I wanted to speak today was to encourage the Minister to consider the provision of a dental training facility in the east of England. So, in conclusion, Madam Ali, I leave to others who are much more professional than I am about how we properly reform the 2006 NHS contract. Say by this, we need to treat dentists with respect. It's not primarily all about money. It's about how you treat people. And please, can we have some training in Norfolk?